My name is Taylor. I am a compliance professional at Good Health Incorporated. Thank you for coming to my presentation. For clarification, we will talk about the trends within the healthcare industry and how regulation aligns with these trends. States' healthcare industry is the most costly healthcare industry in the world currently. Nevertheless, the United States healthcare industry is not leading in patient outcomes and good population health. To combat this issue, there has been a push in healthcare regulation to decrease costs, to improve the quality of healthcare delivery, and to increase good patient outcome. These laws are regulated by agencies such as the Centers of Medicare and Medicaid and the Office of the Inspector General. The Office of the Inspector General is primarily tasked with preventing fraud. The Centers for Medicare and Medicaid is in charge of first providing health insurance coverage for millions of Americans, and second, providing guidelines on how to deliver quality services to hospitals and providers. One of the responsibilities for medical directors is to be knowledgeable of the regulations set forth by agencies such as the Centers for Medicare and Medicaid and from the Office of the Inspector General. It is the responsibility of medical directors to be knowledgeable of these agencies and the guidelines they produce so that they can enact these policies within their department and or organization. Video is primarily for medical directors, managers, or the CEO of Good Health Incorporated. It is important that these parties are aware of certain compliance issues which are occurring within Good Health Incorporated. These compliance issues and the penalties which might occur if the Office of the Inspector General were to accuse us of these compliance issues will be explained. The first violation found within Good Health Incorporated is that bonuses have been offered to medical staff who actively attempt to increase admissions or referrals to the organization. This is a direct violation of anti-kickback laws that were enacted by both the Centers of Medicare and Medicaid and the Office of the Inspector General. The Office of the Inspector General defines kickbacking as any offers, payments, solicitations, or remuneration which is made to induce referrals to an organization. Kickback laws were put in place after it was found that referrals from one organization to the other because of financial compensation often resulted in bias in medical decision making, the overutilization of medical services and equipment, and also skyrocketing costs of healthcare. These were issues and are violations of the CMS conditions of participation because CMS requires that services provided by a medical facility are medically necessary, meet professional standards of care, and do not put patients in undue harm or risk. There are two main consequences of this violation. The first consequence of this violation is financial compensation. The second consequence of this violation is exclusion from federal funding. Exclusion would occur because the CMS outlines the conditions of participation and says that those hospitals that do not follow this outline is therefore not able to accept federal funding. The second violation found is also an anti-kickback statute violation. The situation which occurred is that a Good Health Incorporated facility rented imaging equipment which was housed in a staff member's private off-campus office. This is an anti-kickbacking statute because the Office of the Inspector General found that in these financial relationships where a provider rented out equipment to a medical facility, it often happened where a medical facility would refer a patient to the provider or the provider would refer a patient to the medical facility in a biased manner and sometimes in a manner which was medically unnecessary. Because the Centers for Medicare and Medicaid state within the conditions of participation that medical facilities and providers are required to give medically necessary care. If medical facilities and or providers are found to be giving unnecessary medical care, they can potentially be excluded from federal funding programs. Furthermore, if this violation is found, it is possible that the Good Health Incorporated system will be made to pay remunerations. The internal audit of the billing department has revealed 5 years' worth of medical coding errors, which resulted in millions of dollars of overcharges. This is in direct violation of the False Claims Act, which states that providers or medical facilities cannot claim reimbursement for services that were not provided. The organization, if found out by the Office of the Inspector General, could incur a fine equal to 3 times the amount of false claims, plus an additional 5,000 to 11,000 per claim. Internal audit also found that there is underreporting of medical errors in Good Health Incorporated by medical staff. A medical error occurs when a medical facility or a provider does an action to a patient that may result in patient harm. Medical errors have been an increasingly researched area in the healthcare industry because in 2020 alone they resulted in about 250,000 deaths, which makes medical errors the third leading cause of death in the United States of America. The study of medical errors has also been important because it is in direct misalignment to what the Institute of Medicine claims to be appropriate healthcare which is safe, effective, patient centered, timely, and free of inequity. The Centers for Medicare and Medicaid released, of course, the conditions of participation. The condition of participation states that medical facilities must measure, analyze, and track quality indicators, including any adverse events. Adverse events in this case are medical errors. Any medical facility which fails to report or track adverse events is therefore in direct misalignment with the conditions of participation. The consequences of this include the exclusion from any federal funding programs. The final violation found had to do with the lack of consistent and timely physician peer review of medical errors. A physician peer review is very significant. It allows the physician to work with other physicians to identify the medical error and create a quality assurance program which assures the medical error does not happen again in the future. The conditions of participation set forth by the Centers for Medicare and Medicaid state that the quality assurance program must include, but not be limited to, an ongoing program that shows measurable improvement in indicators for which there is evidence that it will improve health outcomes and identify and reduce medical errors. Basically, what this condition of participation states is that not only should a medical facility report medical errors, it should also take this data collected and work to create or outline a quality assurance program which prevents any medical errors from occurring in the future. The consequence of continuing to violate this condition of participation or of not having a physician review council would be exclusion from federal funding programs. It was stated earlier that it is the director's responsibility to assure compliance to any regulations set forth by a healthcare industry or an healthcare agency. So now we might ask, is there any liability legally of the director when it comes to Good Health Incorporated being in violation of these 5 factors? The truth is that if the director was able to show reasonable inquiry, duty of care, and duty to compliance, then they will not be held accountable for these violations. Reasonable inquiry is the ability of the director to show that they were able to ask managers or their staff about any violation which occurred. Duty of care is the ability of the director to show that they perform their actions as a director in a manner which any other prudent person would have done. Duty of compliance shows that the manager or the director worked to understand and be knowledgeable of compliance and to the best of their ability try to uphold this compliance in their department. Taking all facts into consideration, it is recommended by the compliance team that the Good Health Incorporated self report to the Office of the Inspector General. Self reporting is voluntary, but we would be incentivized to do so. This incentivization includes the reduction of fines of any overpayment, and it would also include the act of not being excluded from any federal funding programs. What would happen is that after self reporting through the Office of the Inspector General website, we would be investigated, we would be penalized by way of fines, and we would be made to enter into a corporate integrity agreement. This corporate integrity agreement is an agreement between the organization and the Office of the Inspector General that the organization will implement certain quality assurance programs. This corporate integrity agreement would be in place so that the organization prevents any violations in the future. While there would be a cost incurred as a result of self reporting, the cost of not reporting ourselves would be far greater. Self reporting would show accountability for the violations that occurred within our institution, and it would also show stakeholders and patients that we are able to take accountability and have a trustworthy image. In conclusion, quality assurance and compliance to regulation is a highly significant aspect within the healthcare industry. Compliance to regulation is very important because regulation is in place to promote good patient outcomes and to protect the American healthcare industry. Any questions regarding compliance issues or quality assurance can be forwarded to the compliance office. Again, thank you and have a great night.